Please welcome the panelists driving these shifts in their own institutions and hospitals, Mr. Prashant Vashisht, Group CIO, Marengo Asia Healthcare, Mr. Praveen Bist, CIO, Amrita Hospitals, Mr. Nanda Kishore, CIO, Continental Hospitals. This session will be moderated by Mr. 𝗙𝗵𝗿𝗀𝘀, CIO, Healthcare Global Enterprise Limited. Huge round of applause, guys.
Good morning, and we know that we are between the coffee break. We had 3 wonderful rounds of discussions, and it was great looking at the opportunities and the avenues where we can work upon from 𝗕𝗵𝗿𝗀𝗀, from Vishnu, and from the panel. And a lot of trust has been entrusted on us, and we would like to slightly move away from the averages and show you what is glaring a bright spot in the healthcare system. All the gentlemen, I have known them for some time now, and we are all very proud of being one of the brightest spot in the healthcare ecosystem in India. And I would like the panelists to introduce themselves briefly, and then we will go about going through the journey which we have had in the last 3.5, 4 years. All of them have spent around the same time with the institutions, and it has been a journey. There has been accomplishments. There have been challenges which they have overcome. There are pathways which we have defined, which I got to know while I was speaking to them for the panel. We will be very comprehensive. We will leave a little more time for questions, because the more you ask, the more we can tell you. Otherwise, all of us have the potential to eat up the entire panel time. All right. So I think we'll start with you, Praveen.
Hi all, good afternoon. I am Prashant Vashisht, Group Chief Information Officer for Marengo Asia Hospitals.
Good morning, everyone. Or maybe it's afternoon now. I am Professor Praveen Bist with Amrita Hospitals. I'm the CIO as well as Assistant Registrar for the Faridabad campus, and we'll get to speak more as we have questions.
Good afternoon, everyone. I am Nanda Kishore, CIO of Continental Hospitals, Hyderabad.
Okay, thank you. That was really crisp. Nanda Kishore, I'll start with you. You know, in your institution, I had the privilege of visiting the institution once. You know, the way I see it, you have started, as even Dr. Nambiar was saying, that we started from scratch pretty much in the digital transformation. How has your infrastructure played a role in terms of keeping up to the latest things? You know, when I visited, it was very, very feeble. It was not so much understood. How have you think that has evolved? Would you tell us?
Yeah. It's been a privilege for me to be a part of Continental Hospitals, because from the inception, our vision was very, very clear. Like we build an ecosystem for the future readiness. Okay. When I say about the future readiness, we have taken into the detail, like should we have the Wi-Fi infrastructure? Should we have the backbone network infrastructure to the patient rooms? So all these kind of things were taken care when we were really designing the infrastructure ecosystem. And we have our own data center of 2,500 square feet, and we have built in the ecosystem across the hospital where it supports the clinicians, because that is where the real adoption for the digital transformation starts. So to be more precise, we had the champions on board before 6 months before the start of the operations. So when we were starting the operations, when we were talking to a few of the clinicians or the doctors and all, when we were explaining them about the EMR, at that point of time, it was very new to the industry. So many of them were not so keen of really using the systems. So we created a layer like called as a physician assistants between the patients and the clinicians. So most of the major data inputs were taken by the physician assistants. So it becomes easy for the doctors to go through and give the patient care. And today, when we are talking about the AI and other tools, our ecosystem is ready to adopt to that technologies. And interoperability, what Dr. Nambiar was mentioning, we are adapted to the tools where it's possible it's possible for the interoperability.
Well, thank you very much. I would like to move to Praveen. Praveen, I learnt about the infrastructure in terms of the brick and mortar infrastructure you have built up in Amrita. Apart from the digital, I will come to the digital later, but it is an ecosystem which is replicated like none other. You have a medical college, you have a nursing college, as well as an engineering college, which is pure tech. How is this ecosystem intertwined? Everybody would like to have a brief introduction to that.
Sure, thank you. Pretty relevant in times where we are all talking about AI, we are talking about application in healthcare. We at Amrita, being a university as well as a healthcare provider, we understood not necessarily way early on, but definitely down in the journey. We started with the hospital, nursing college, medical college, but we understood that unless we have a trained manpower, trained resources, it is not going to happen. So we started this idea of AI in healthcare as a engineering degree in BTech, MTech, and we are offering that. So when we look at digital transformation, it's definitely patient is in the center, but we have the power users, doctors, clinicians, we have our students, which forms a big part of it, and also our employees. So it's a complete circle when it comes to digital transformation and how we envisage that it brings value and it has to be integrated. So that's been our foundation, so to speak, and we have been very unique that way. And but we are very fortunate that our management has been very supportive of it, given the challenges of budgetary constraints. But once we have defined what we want to do and we clearly lay it out, we have been welcomed, and requisite arrangements in terms of budget, resources have been provided to us. So we've been very, very lucky with that. Thank you.
Correct. Great. Prashant, the entire institution you represent is quite new, but in the same time you have done quite remarkable as creating it as a platform, as a fabric for delivering healthcare. Would like to know some more about that.
Well, we laid down the foundation of Marengo Asia Healthcare 4.5 years back, and the core objective of the group was be patient-centric. Patient care should not be compromised, and we divided it into 3 pillars. Like, first is patient experience, second is clinical excellence, third is operational excellence. And we focused on all these 3 areas, but our management, our promoters were quite aware that this is not possible to attain wow experience, not possible to attain that sort of clinical expertise, not possible to ensure operational excellence everywhere without the support of IT. So at very initial stage, before even kicking off this venture, we were quite determined that we will go ahead with IT technology. We will go ahead with IT savvy approach, all the processes to be driven through system-driven approach. And that's where I think we felt like we have been fortunate. Being a CIO, it was not possible to roll out all your ideas, but being a kind of worker of such a massive workforce, such a great IT savvy promoters help you a lot to drive your ideas and convert them into reality. So we focused on clinical expertise, we focused on patient experience, we focused on bringing in operational excellence, and we accordingly laid down the journey of digital transformation. We started with amazing platform of hospital information system, and in hospital information system we added up all modern systems. You beat patient experience, be it your mobile app, be it your other things like electronic medical record. We added everything under single umbrella. And then we start, in the first year it was quite difficult, no doubt all, because it's truly difficult to roll out all your ideas on day one. But we gradually trained our staff, we gradually created the champions in the organization, and they lifted the flag. They were kind of, flag barriers. And they became our brand ambassadors, especially I would say the brand ambassadors of information technology. And today we have reached to a level wherein under the single umbrella we have electronic medical record, we have cutting edge technologies. You talk about clinical expertise, we have robotics, we have done many transplants as well, because we are known for transplants, and it all turned possible just because of our approach, which we decided at very initial stage that we want to be differentiator, and that was possible just because of information technology, just because of technology support. I'm quoting one example to you, how we are saving the lives of people. We have enabled one technology through which the system sends alert prior to stroke. System sends alert to paramedic, clinicians, if any stroke is about to happen, and due to this, we saved many lives in very recent past. And we have published one article also on the same technology. So overall, if you see, we are quite satisfied, but yes, it's a long way to go. Going forward, we are going to add more feather in the hat, and definitely will bolster our all ongoing initiatives.
Prashant, you made a very pertinent point. And in this, I think one of the points which maybe had made, that what will you like to take and what you will like to not take from the US healthcare, prevention and rightfully making sure that the care is provided at the right time can reduce a lot of cost. More so from the organization which I come from. In India, cancer is detected at very last stages, unfortunately. So we are working very proactively to make sure that there is awareness, so that cancer is treated at an early stage. Outcomes are far better and cost is 1/5. So a pertinent point in saying that, you made a solution which would give an alert and prevent the more you have delay in terms of giving care to such a patient, the better it is. I would like to ask you, Praveen, again, while you were building this, because we are representing an set of organization which was privileged to get a lot of attention from the management, we were also able to collaborate with them and we were able to hatch our plans. But for a rest of the world, which Dr. Uma was talking about or Vishnu were talking about, they are not so privileged. They would like to know about our journeys. So for Prashant, I would like to ask, at Marengo, while you said that, the first year was challenging and you overcame how you built that platform, what were the kind of challenges you faced and how did you bring back? If you can give some top 5, top 10 challenges, and then how did you cross them?
The first challenge was the acceptance from users. It sometimes turns super difficult to convince users and make them understand about the value proposition, number one. And definitely selection of partner is Herculean job, especially when you have plethora of vendors across the table. And selecting right product is something which had really taken a lot of time. And for everything, there is a gestational period. Technology maturity also takes certain level. I said it has taken 1 year time to reap the benefit. Today we are reaping benefit. Today, patient engagement platform there, wherein thousands of appointments are coming every month. We have, another patient engagement platform for IP patient, wherein IP patient themselves can scan the QR code and order anything, including food can be ordered from the bedside, for patient attendance, right? And many more things are evolving in nature. You cannot build the technology and cannot reap the benefit on the same day. It takes its own time.
Correct.
And another challenge, which is again really very, you can say it was kind of a toll on us, was showing the impact of your technological effort. Because you start gradually, you cannot showcase the value or in a month or two. It takes time to convince user, to convince your patients as well. At times, patients feel like, no, I do not want to go ahead. I do not want to upload my documents for insurance approval. So that's where it takes little longer.
So usability challenges.
Usability challenges, yes.
And when you were building the platform, since it is a very comprehensive and integrated platform,
Yes.
you had challenges bringing together the partners, which you had to probably treat through the project management
Right.
office.
I believe in one thing, one more thing I would like to add. I think people, process and infrastructure, when they three come on same page, then only you can enable something outstanding.
Agreed. And so Prashant, in Amrita, it has been a journey for you. What are the new things you are looking at in this digital transformation? I know that you have special use cases on AI, which I will come to. But in transformation, how has been the journey? How, are you measuring some key measures or KPIs which are indicative of how the efforts has been successful? The panel before was saying that we should have measures on, what outcomes can it build from a business point of view and also from a patient care point of view. So can you give some examples where business has benefited and you have measured? It need not be, as Prashant was saying, that it need not be day one, we are like 80%, 90%. But what has been the progression? That is what, if you can share.
Sure. So we've also, have heavily invested into technology, and when it comes to some of the use cases or some of the examples, lately one of the areas that we have focused on is conversational AI, and one of the reasons is because we serve a very vast population, and it comes from different sectors. So ours is more like a private hospital, but it is belonging to a trust. It's a non-profit, and therefore we get people from different sections of the society. So whenever we come up with a solution, it has to be applicable to every single patient, so to speak. So in conversational AI, we found that advantage that patient could be speaking, वो हिंदी में बात कर सकता है, बहुत English में बात कर सकता है, any other language he could be, and he or she may not always be digital friendly. तो अगर आप उनको कुछ टाइप करने के बोलेंगे या कोई ऐप यूज़ करने के बोलेंगे, it may not be so much easier for him. But when you have conversation based, it helps, and that has really become a good example. We are using that not only in patient engagement. It could be we are using it for appointment booking, for example. We are also using that as a reminder. Patient could have a reminder coming from the system about their medication that they have to take. It could be coming in this voice of the doctor that they saw. So that makes it even more powerful and very, very helpful to the patient. We are also using that technology now for transcribing patient-doctor interaction. One of the lacunae that we have seen, I have been in the US for over a decade. It's the same problem. Doctor doesn't want to key in the data. Unless the data is digitally present in the system, you cannot apply any of the AI models for that matter, right? So you have to have digital data. So, and that problem is only bigger in scale when it comes to India. And with that and technology, conversational AI specifically, we have used to capture that conversation, transcribe it, and also categorize it. Agar doctor patient are talking about some non-relevant information, AI will take it out. It will not use it. If I'm talking about some diagnosis, some prescription, some medication, it will categorize it in the right manner, and that can be pushed back to the EMR system, making it digitized and saving the time of the doctor. So it's been a tremendous help, value, and we are very, very excited, and we are only hoping to replicate that and roll it out to other use cases. So conversational AI is one example that I would like to highlight.
Praveen, a leading question on behalf maybe. Does this documentation, it is of course making the clinical team more efficient, the administrative team around clinical very efficient. It is making the patient care more flexible as well as to be adhered to a particular treatment plan? Is it also helping business? Probably, I believe a corollary could be that it is also helping in claim management, because every documentation is there and you will have lesser and lesser disallowances if you have all kinds of evidences already there. So do you see there is a upsurge in the way you were managing claims from the payers who are impaneled with you?
Absolutely. So not only in terms of the insurance payments, it also has improved our number of patients we could serve, right? And it is also improving the actual healthcare delivery, actual efficacy of the treatment or efficacy of the solution that we are going to provide. Like appointment booking system is an excellent way. So we need not wait for an actual human agent. You could actually be conversing with a bot, and then the bot will be conversing with you, asking the right set of questions and ensuring that you are able to take to the appointment with the doctor of your choice. So things of that nature, it has helped in every single way, operationally, clinically,
business-wise as well. Business-wise,
yes, absolutely.
Nanda, Kishore, we represent for-profit organizations in healthcare. I know that businesses ask for a lot of data. Supply chain will ask for data. HR will ask for data. Does your clinical team also ask you for data for their, let's say, writing papers, doing some research, collaborating with some research organizations like IISCs or IITs? So do you come across such demands, and how are you meeting those demands?
Yeah, that's a good question, Sudeep. Yes, we do get a lot of requests from the clinicians for the research or the papers they want to go for publications or anything. So we have created a team of clinical research internally within the organization. So they work very closely with the physicians, like the kind of data they are looking at, and we create a data repository for dedicated for the research purpose. So we have around 5 people team internal which work with the specialty wise research needed for the clinicians. So that is one way we are looking at, and recently we started adopting the AI tool onto that data, so it becomes more precise. It's like a chatbot for the clinicians, like what kind of data they are looking at. So these are the small steps what we are taking.
Okay, 2 rounds of more questions from my side, and you have a question? Okay, let's make it quick. We can have in between questions, but we will have 2 more rounds. I am personally interested in knowing as well. Yes, Vinay.
Okay, to be very quick, Prashant talked about the challenges, in the implementation of digital transformation of digital healthcare projects. This question is for everybody. How do you implement the change management within the organization? I think this is a very important aspect of any IT, transformation project. And does your team have change management people inbuilt into your team? That's my question. Thank you.
To do justice on time, we'll take a shot of 2-3 points quickly.
Yeah.
Yep.
To answer your question, yes, we do have a process or change management team internally within the organization where it involves the clinicians and business decision makers and the IT team. So whatever the change is being asked for, we first analyze what is the objective, whether it's really we need to go for the change, and what is the cost implications to the organization. So
right, but as far as the users are concerned, right, because maximum resistance comes from the existing people who are, because the workflows are going to change or are going to be a bit modified. So how do you get that into place in the projected time frame?
Yeah.
So one of the ways that we have tackled, it's a very pertinent question and a challenge that we all face. One way that we have, kind of gone around it is we implement in one of the departments, for example. Suppose we have 80 different specialties in our hospital. So instead of trying to implement that across all 80, you start with 1 or 2, show the success, and then build upon it. Then people do get convinced. So, and to pick that one specialty you start off with, you have to be careful enough, right? You need to look for the right person who are more proactive, who are more, willing to work with you, take risk, and then make it a success. And once you do that, then it becomes a easier battle to.
Well, I think change is the only thing which is constant in nature. So it's kind of something which is inevitable. So our strategy is very simple. We set one particular change in one department first and showcase the benefit to others. And showcasing the benefit means we say this is for you, not for me, not for organization, not for promoter. It's for you first. Then only the benefit to be extended to organization. If you are happy, we are happy. And I have seen in majority of cases acceptance do come. Honestly, difficult to attain acceptance from clinicians. Different question, but yes, in majority of cases it comes.
Vinay, two lines and one example. 2 lines are change management has to start prior. We have to do stakeholder analysis and stakeholder management. Stakeholder management will involve some communication. If you build with them, they adopt faster because they also think that it is built by them. If you build and go, then the example is, I was taking a change to one of the tier 3 towns, tier 2 towns, Nasik. The doctor, I had created a 20-minute presentation with 10 slides to tell him what is the benefit of whatever we are asking him to do. That doctor sees in a day around 200 patients, 250 patients, oncologist, star doctor. He turned out to be a poster boy. And I only had to spend 10 seconds to tell him that what is to be needed. Stakeholder analysis, stakeholder management. Till today, he is at the highest level. Our EMR adoption overall, along with support staff, is at around 82%. Doctors, it is around 41, 42%. But he is at 83% standalone. He is the poster boy. So stakeholder analysis, stakeholder management precedes change management. Coming to our questions, I would like to know, with so much of data, we are significant data fiduciaries. How are you trying to protect the data? Because you have processors who, I'm sure the entire data is not processed by you. You will have partners who are working with you. How are you ensuring that even though the rules are still not given as enactments, what measures are you taking internally? How are you educating your people on data privacy, information security? Just a few lines if we could.
Yeah. Since we have our own data center, whatever the tools we are implementing it on premises. We are not implementing on the cloud. And very frequently, we do have some sessions with the clinicians and the nursing staff and all about the importance of the data security kind of thing. So, for example, what we do is randomly we send out a mail from chairman's office to all the employees, like there is some bonus being given, please provide these details kind of thing. So we analyze like how many people, either it's a doctor, nurse or any technician, how they're responding to those kind of emails, phishing emails or anything. So we analyze this data and we do conduct sessions to the users, like how important it is not to respond these kind of emails and what is the importance of the data privacy involved in the organization.
Praveen, do you also do such activities for educating, as well as do you inwardly come over, attack your own system, do a vulnerability assessment or something like that? How do you secure and how do you train, how do you educate people?
So, yes, we do all of that and much more. Unfortunately, with technology now, with AI, you could mimic everything. You could mimic the voice of maybe your boss speaking to you. You can have a video that could be fake. So it has become more and more challenging, some of these things. But we have implemented, and fortunately, we are, like I was mentioned, we are a part of the university, and we do have a lot of research group, and we have one particular group who focuses on cybersecurity. So they have been of great help to us. So we have utilized some of the system that they have developed, and we're fortunate enough. We feel that we are secure, but like I said, things are evolving. The attackers, so to speak, are also getting more and more smarter, and unless and until we are one step ahead of them, things can be of great risk. So we're trying every measure possible, and we try to use every single opportunity also to engage with the users, because finally, if we are ensuring the internal safety, that is a good part of the battle that has been won. But yes, with the tools, cybersecurity tools, and putting things in place, I think we are able to address that problem.
Thank you. Prashant, a different kind of a tough question for you. Prashant, 𝗕𝗵 has a very good ecosystem where they are interacting, evaluating vendors, partners, probable ones, bringing them on board and incubating them, growing with them. And Alka has pointed out that there is an outside-in view, and even Vishnu was saying, which I firmly believe in because I have loved operating with startups and beginners who are really keen to go. But that is, I think, to my experience, is around 10%, 15% of the startup. I don't want to look down upon anything or anything, but there is a lot of fly-by-night operators also. How do you make sure you are interacting with the right kind of partners? What has been your onboarding mechanism, and how do you safeguard your data there? Sorry, a little different.
Okay, really tough question. But before that, I would like to pass on appreciation to Vishnu for his mind-blowing opening speech. And you really impressed a lot with your speech, with the insight you shared with everyone. Thank you. Now I'm coming to your question. What we do, our approach is very simple. We try to understand the value proposition first. And then we see whether this will add value to my patient care either, or to my clinical excellence, or it will bring in some sort of efficiency across the group. And then only we feel like, okay, this is the time to invest on this particular technology. Best example, recently a year back, we came across a mind-blowing technology flooded with AI elements that could sense, okay, this patient is going to fall under MI or stroke. We did some study, we discussed with stakeholders and called 2-3 partners to do the evaluation. And truly, our clinicians were, super glad seeing the outcome of this technology. And then after we thought like, okay, we should invite few more partners who could really join this bit. And we invited and selected the one who had some past track record either. Okay. We normally, when we talk about such technologies which are really affecting my patient care, we normally do not want to, take too much of risk in terms of data security, in terms of, data privacy, or in terms of some sort of intrusion or errors. Because when you buy all such systems, some free gifts are bound to come back to you. So we do not compromise on that. We have a dedicated security team. We have a dedicated application team who do each and every activity well in advance. Okay. VAPT also is being done well in advance before even acquisition, right? Yeah. And various other criteria are there in place. Once they are through on those parameters, on those criteria, then only entry is possible.
Perfect. Here you completely. I would also like the same question to be answered by both of you.
Yeah.
How do you select a partner?
Yeah, I would just like to highlight and maybe point out one more parameter that we specifically look out is, if there is solution, standalone solution, it has to finally work as a part of the workflow, right? So no user would want to use one system and then suddenly go, use another tool to do some activity and then come back. Unless and until you are able to weave it as part of the workflow, then only you'll get acceptability from the user and also biggest bang in terms of the utility of it. So that is one thing. Before we, there are so many vendors that come, so we always ask them also, how do you think it will fit in the part of the hospital workflow or the university? So I think that has been helpful.
A quick question here. Yeah, hi. From a founder's perspective, right, I think it's a common pain point across all of them, that who bears the cost of this AI transformation? Because nowadays you see GPUs, etc., running on Azure and AWS clouds, they cost a lot. In US, the model is to combine it with the insurance. So basically, hospitals can partner with insurance companies and they would bear the cost. how is it being done in India, and how can founders be involved here?
So, may I take that question?
Yeah.
So, may I get your name once, please?
Yeah, my name is Kunal.
Kunal, we had 5 use cases about 18 months ago. The question is so pertinent, and we were successful with 2 of them. And in one, we were successful, but we yet did drop it from the AI perspective because of the cost parameter. It is onto the founder and the company which is partnering. It is more also on the people like our group who have to justify what ROI we are getting, whether otherwise, Google will also be running AI for their normal searches. They are not running. They are still using the indexing. It is just because of the cost which goes up, and it is paramount. So it is on the company which is looking for a solution. So look for a solution as a use case, then see what is the total cost of ownership of running it on AI. So as I said, one of the use cases, we made it successful, but we did drop the idea because it was turning out to be more expensive. So it is the solution first and then the technology. All right. Yeah.
Follow-up question to Praveen.
We have a time of, we'll connect with you.
Another question, like,
The answer, yes, of course.
Okay.
The answer I was looking at is, and this is for Vishnu, the marketplace is a very good idea. The solution marketplace, the DHN marketplace, which I heard from you in your presentation, that stuck with me. And I think it did not occur to them, but we have a tough time evaluating people because we get a lot of flurry. Everybody is trying to do something. No questions on the intent part. But it is healthcare, and especially the new age technologies are a long-term journey. If you are collaborating, and not everybody, as I said, is as blessed as 𝗕𝗵𝗴 is in his institution, that they can incubate, they have funds, resources. We are getting there. So I think the marketplace thing is what I was looking for as an answer. Thank you very much. We are all open to questions in the audience time. Thank you.